Hello everyone, this is Jacob, charge nurse from Merisical North and South. In this video, I'll be showing you the new discharge tool to be used in our trust to safely discharge our patients. But before we go into that, let me show you 3 actual patient scenarios that happened in the past that will help us understand the importance of having this tool. Case number 1. An 85-year-old woman with dementia was discharged late in the evening and arrived at her house at 11 p.m. The next morning, the doctor found out that she had been left with no food, drink, or bedding and was unable to get herself to the toilet. Case number 2. A 96-year-old man admitted with falls was cleared for discharge by the medical team. He was sent home after 4 p.m. on a Friday. He needed insulin injections and once-a-day carers. Although all the referrals were done, the district nurses did not come to the patient. There were also no carers for the weekend, as the arrangement was actually carers once a day only on weekdays. On Sunday, the patient had another fall and was later readmitted to another hospital, worse than he was before. Case number 3. A 17-year-old man was admitted for paracetamol overdose and finished his NAC treatment on a Saturday. A junior medical doctor classified him as low risk and was cleared for discharge. The patient was sent home with his mom. The next day, he went out of the house to get some air, but he never came back. He was later found in their local woods, hanged from a tree. What went wrong with these scenarios? Number 1, the family was not informed of the late discharge. 2, it wasn't picked up that the carers were only for weekdays. 3, although the district nursing referral was sent, the out-of-hours process wasn't followed. 4, the 17-year-old man was assessed using an adult mental health tool. And 5, the junior doctor was not challenged and no psychiatric review was done for the mental health patient. We must all remember that all our patients have vulnerabilities in one form or another. It is our responsibility as nurses to make sure that they are safely discharged. METHOD is an acronym which stands for medications, environment, transport, hospital attachments, outpatient follow-up, and discharge documents. Discharge method is a 2-page form. This is page 1 and this is page 2. Let us now go through each section. On top of the page, make sure you write the patient's name, hospital number, and the date when you were filling the form. To fill this form, you simply need to put a tick if it's applicable or you've done it, and a cross if it is not applicable. There will also be spaces where you need to write certain information like telephone number and dates of appointment. For medication, you have to check that the TTAs provided are the same ones listed in the discharge summary. You must go through each of the medication with the patient to make sure they understand the dose, the frequency, and when to stop the medication. You also need to check if there is any controlled drug, as this will be kept separately in the controlled drug cupboards. If the patient is going home with injections like tinzaparin, make sure they have a sharps bin to go home with. Some patients may require to be given a few dressings if we have requested the community nurse to come to the house and do the dressing for them. Some of our patients may also need a few pads depending on the home situation. Lastly, we need to make sure that the bedside cupboards are emptied, including the patient's own drug cupboards at bedside. Moving on to environment. We must check first if a Section 5 or a Haringey referral has been sent. This notifies the community that the patient is going home. We must also make sure that the next of kin has already been informed. For care package, we need to know the frequency and especially check if the weekends are included. We should write who we spoke with to confirm the package of care and their contact number. For patients who need district nurses, make sure the discharge summary is emailed along with the referral form. Also, you must give the patient the district nurse leaflet which contains the number that they can call if for some reason the district nurse does not come to them. If you made the referral out of hours, make sure you confirm the service depending on the borough where the patient lives. These numbers can be found on the form for the district nurse referral. For mental health patients, once they are medically cleared, make sure that a mental health team review is done. If necessary, make sure the community crisis team referral is also done. Write the name of the person you spoke to and their contact number on the form. For transport, we need to take whether it's hospital transport or own or private transport. If it is hospital transport, make sure you write the booking number so it is easier for the team to chase the transport later on. Make sure that the patient has their house keys. There have been cases before where they came back to the hospital because the ambulance team could not get in to the house. For hospital transport, make sure you book them as ready. I repeat, book them as ready. Transport will not come unless they have been booked ready. This should be done on the system, but if you do not have access to that system, then you can call transport team in the hospital. For hospital attachments, make sure you have removed the patient's IV cannula and disposed confidentially the name band. If the patient goes home with a catheter, the bag must be changed to a leg bag. And most importantly, for any patient, make sure they have had their wash and are wearing their own clothes if they have. If not, they can be sent with the hospital gown. For outpatient follow-up, make sure the patient is aware of his ambulatory care follow-up date or if he needs to make a GP or clinic follow-up sometime in the future. Lastly, discharge documents. Make sure you go through with the patient the contents of the discharge letter. Give the patient a feedback form to fill, as this helps us evaluate the level of service we are giving and if we need to improve on a certain area. If the patient is a mental health patient going back to a mental health facility, make sure they go with their section papers. If the patient is not for resus, make sure they go with the DNAR form. Now that you're done, make sure you let the patient sign at the bottom of the page, followed by your name, signature, and your band as the person filling up the form. So, where can you find this form? The discharge method used to be a separate sheet, but now, after piloting in the CCOs, it has been incorporated into your nursing cardex, also called as Patient Details Sheet, and it is located on page 6 and 7 of the said document. Now, I can hear you asking me, why are you giving us another paperwork to do? But let me stop you there. Actually, I'm saving you from doing too much writing, because everything that you can write about a patient who will be discharged is already here in the discharge method. All you have to do is complete the form, sign at the bottom, and that's your nursing documentation. If there's anything at all that is not covered by this, you go to page 2 and write your additional comments or additional notes. And that's it. No more long paragraphs of nursing notes. Jan,
Hello.
you okay?
Yes,
You're finally going to be discharged today.
I am very happy, thank you.
Good, I'm happy to hear that. So to make sure you have a safe discharge, we'll just go through this checklist, okay?
Okay.
So This is called the discharge method.
Yeah.
So first, I have your medication here, okay?
Yeah.
For your asthma, there's only one salbutamol inhaler, which you take when you're short of breath. You've done this before,
Yeah.
so you know how to do that. Is that correct?
Yes.
Okay. And so, okay, so this is your TTA. I've got your discharge letter. I've read it, and the only medication is that one. So I've compared that to the list, and you've got nothing else to wait for. You've got no controlled drugs, no need for the Sharps box, no dressings needed, and that your bedside cupboard has been emptied by the healthcare assistant earlier, and everything is in your bag. Correct.
Okay. Thank
Okay. So you don't need any referrals, no carers, no district nurse, and you don't need any psychiatric review. For your transport, since no one can come to collect you, I've booked you a hospital transport by wheelchair, okay?
Okay.
And I booked it ready earlier at 2:30 in the afternoon,
Yeah.
okay? Have you got your house keys with you?
Yes. Yes.
Good. Okay, and I've spoken to Karen. Just to make sure your attachments have been removed. So, your cannula, okay, that's been removed by Anna earlier. Now your name band, I'm just gonna cut this off because I don't want anyone knowing your date of birth and everything
Finally,
else.
I'm relieved.
Okay, you've got no catheter, no need for that. And this one, you have been washed, is that correct?
Yes.
Okay, you just need, when I'm finished with this, I'm gonna ask somebody to help you to change to your own clothes, okay?
Yes.
So I'll leave that for now and I'll take that when it's done. Okay, you've got no outpatient follow-up.
Yeah.
And you're advised to go to your GP after 2 weeks.
Okay.
Okay?
Yeah.
GP appointment. Okay, and the discharge letter. The important thing there is that they've written is for you to have a GP follow-up after 2 weeks. Okay, all your lab results, x-rays and everything is in the letter. Okay, so that will be your copy.
Yeah, thank
We'll
you.
send one to your GP. Okay, and we have one for our copy.
Okay.
Feedback form, I'll come back with that. And just a quick feedback of how the service was in this ward.
Good.
Okay. You don't need the section papers, you've got no pink form. Okay.
Yeah.
I just need you to sign here to say that I've given you the medication and I've gone through the list with you. Is that okay? Are you happy with that?
Yeah.
Okay. Okay, and then I will write my name as a nurse discharging the patient. Okay. All right, so I'll ask the healthcare to come and make you ready for the transport.
Yeah.
Thank you very much, Ms.
Thank you.
Chan.
Thank you.
All right. Take care. If you found this video helpful, please click the like button below. And if you have any questions, comments, or suggestions, please put them on the comment section. That's all for now. Stay safe and stay happy. Bye-bye.